We're flying north to the scene of a crisis to see firsthand a fix that seems to be working. The further you get from major cities in Canada, the fewer physicians there are. That's left many small ERs forced to shut down, many rural Canadians without a family doctor.
Oh, she's just little. Who's with her?
No one, she's here by herself.
Oh, we should call Tick.
But this hospital is on the front lines of a solution.
Hey, my name's Dr. Duffy. What's going on? What's brought you into Emerge today?
Dr. Brenna Duffy is a graduate of the Northern Ontario School of Medicine. It has campuses here in Thunder Bay and in Sudbury, but its classrooms are often empty because students are not just recruited from small communities, but trained in them too. So they remain as doctors in Canada's rural and remote areas. Do you think you'll ever work in a Toronto hospital?
Definitely not Toronto. No offense to my urban colleagues, but I just don't feel like you would get the same kind of challenges and interest that makes medicine fun.
Half the medical school's grads are now working in Northern Ontario. The rest scattered across Canada, often in rural or remote areas.
So this is Dr. Pacey, he's our resident.
Hey there, how you doing?
Yeah.
Like any medical school, students spend time as residents in hospitals, but the similarities largely end there.
Okay, so that's looking really good.
And that has the Dean of Medicine, Dr. Sarita Verma, calling the school by a different name.
The No Ordinary School of Medicine.
Are all the rooms full?
All the rooms are full.
Okay.
That No Ordinary School of Medicine has been running for 15 years, and it's about to double its class size, not just because of the need for rural docs, but the growing demand for the way it teaches.
Your training happens in communities. It doesn't happen in a classroom. You know, we have learners who show up and within the first week they're actually assisting in delivering babies, actually doing surgeries as the first assist. They're on call in Emerge. That's very different than having 14 other learners around you in a big hospital and you're kind of, clamoring for that one patient.
So this is our healing room.
It's a wider education too. 90% of the patients in this hospital are Indigenous.
We provide all the medicinal stuff they may need.
And so students like Stephanie learn from elders like Kathy.
We have a little kitchenette that the traditional healers can come and make their medicines, because this hospital, it's not just for Western style medicine.
That pairing of medicines, both the hospital and school agree, helps mend historical wounds of mistrust.
So this is what the cedar tea looks like.
And what's the cedar tea good for?
Well, it's got a lot of vitamins in there.
And if you've ever eaten hospital food, check out the duck breast, moose stew, and wild rice pudding on the menu here. As Kathy explains, everyone has a goal: how to help people get better. What does that mean for the patients, for Indigenous patients who are here?
It means that their culture is respected, because you don't heal when you're not happy. In fact, you get sicker.
Those patients from whom the students learn come from a vast area, 32 different communities. Many arrive by air, and so when they come, there's usually a pressing health issue. For patients needing to stay longer, there's hostels on the site. Now, it's one thing for those medical students to be in the Sioux Lookout Community Hospital, but the area that hospital serves is the same size as Germany, all in Northern Ontario. And it is in smaller communities like this one, Lac-Seul, that they get their biggest education.
That's the outside. It's the inside, and it's really rough, of course.
First-year students all do a 4-week immersion living in an Indigenous community.
And where do you go next?
Rosemary Rankin and Tafim Unnisa are immersing themselves at the Lac-Seul First Nation, 40 kilometers northwest of Sioux Lookout.
Thank you.
They shadow workers in the health clinic, hear about diabetes and specific health challenges on the reserve.
You're going to push the purple one first, then the yellow, okay?
All of it education.
3 tablespoons of lard.
But not what's taught in most medical schools. like this lesson on making bannock with an elder and learning about diet on Indigenous communities. Tafine was born in Pakistan, where her family had seen firsthand the effects of doctor shortages. But she was surprised settling in Timmins, Ontario, that rural health inequities exist here too.
There's such a lack of healthcare due to the geographical limitations of Northern Ontario, and it made me want to pursue it. There was also a lot of inequities for minority populations.
You're going to be part of the solution.
Hopefully, yes, one day.
Why is that important to have these students come to this community?
I think a lot of people have misconceptions.
Busting misconceptions is important for Clifford Bull, now chief of Lac-Seul, but he also points back generations when his predecessor signed a treaty with Europeans.
The way he expressed the treaty was that if you lend me one of your daughters and one of your sons to come live with us to teach us what is good, then I will lend you one of my sons and daughters to live with you so we can learn from each other.
This is what your ancestors said to the white people.
Yes, the treaty commissioner. And then if you do that, then I will shake hands with you. So there was always this idea or value of sharing knowledge with the newcomers.
Really buff arms by the end of this.
Back in Sioux Lookout, the knowledge sharing continues. The small town focus and decentralized teaching approach of the medical school is catching attention across Canada. Do you think what you've got is the solution?
I think it's part of the solution.
Dean Sarita Verma, now regularly being called by much bigger schools for advice.
We think it's the template for success for all of Canada.
We hear so much about crisis and failure inside Canada's medical system that stories of success can get drowned out. But recruiting future doctors from small communities, training them there so that you have physicians who will stay in places they're needed most, is actually working. It may not quite be utopia, but students and graduates are keen to celebrate.